This is my audience. Hello, everyone. My name is Krista Walker, and this is my career speech. I like to take the time out to inform my audience of my current position in my career and the career path I'm taking for my overall goal. As a kid, we all grow up being asked, what do we want to be when we grow up? As a kid, I never knew what I wanted to be. But I did know for a fact I enjoyed helping people. I enjoyed spending time with my elderly family, my aunts and my uncles, when the average person would have thought it was a punishment. I myself enjoyed it. So I was first introduced to nursing because my grandmother was a nurse and my grandfather was a nurse in the military at the VA. And my best friend received her CNA when we went to high school. So at that time, that's when I learned more about the stories and more information about the medical field. So as soon as I graduated from high school, I went to an adult school in California and was offered a 12-week CNA course. For my experience as a CNA, that helped me decide whether or not I want to continue my education to become an LVN. As soon as I ended up going into the LVN program, which required to take an approved educational course, which should be from an accredited school, and that included theory and clinical hours. After completing school, I then took the NCLEX boards, and you have to pass that in order to get your license. So I attended a trade school. There's other options for so many people. I know in California they have trade schools, but here in Washington State, I have not heard that they had any. So you do have the option of the 2-year college where you have to take your prerequisites and apply for the LVN program. I know the acceptance varies because there's a lot of people applying for it. And then also you can go to an adult school, which that's where I obtained my CNA. So one of the requirements is that you have to renew your license every 2 years. You have to take CEUs, and the CEUs is just continued education that you have to continue to learn throughout the 2 years. And then you also have to pay $200. That's one of the fees, and you can look up that information through the Board of Licensed and Vocational Nurses and Psychiatric Technicians in California, but it does vary from state to state. So currently, I am working outpatient clinic at a hospital, and I enjoy working with a variety of patients. I'm used to working with geriatric, but in outpatient, I work with young, older, sick, and healthy. And working in a hospital, what I enjoy about that is you have a variety of departments to see what fits you. For me, I like moving around. I like to experience different settings so I know what I like and what I don't like. And so the options outside of the hospital, you can work in a nursing home, you can do home health, you can do hospice, drug and alcohol. You can be a travel nurse, which during the pandemic, I met so many different traveling nurses and got more perspective of the experience of being a travel nurse, which is flexibility. You get to travel, they pay for your room, your board and all of that. So that's great. And then also another plus of that is you can use your compact license, which a compact license is a license that covers multiple states because normally each state requires a license. So with this nurse license compact agreement, that's through nurses.org. That's where I got my reference for that. And then for my job that I do for my duties is, of course, we do vital signs, we educate our patients, we do EKGs, bladder scans, Foley catheters, and a variety of things. So for me, that was something that was different and I enjoy it. And you transfer patients to the ER for further evaluations. And the average LVN in Washington State gets about $56,000 to $62,000 for new nurses, but ranges based on city, education, skills, and years in your profession. So you can negotiate how much you would like to get, and that reference is through salary.com. And the other reference I used was nurse.org, again, if you didn't get that one. So every day there's an opportunity to work with different people. through the sickness and pain, you can put a smile on their face, and that's what I enjoy being able to do. So despite the struggles nurses are going through, there's always so many opportunities to bring positive into the atmosphere, which outweighs whatever the struggle is throughout that day or throughout the week, whatever it may be. So although nursing is a job, there's hard work and dedication, and my mission is to put impact on my patients for greater good of the healthcare. And giving to my patients is not an option. So the most rewarding part about being a nurse is the impact. So the impact that I'm making on many lives is through compassion and taking the time out to listen, which makes a difference. And I think that's one of my strengths, is that I have patience and understanding, because if a patient is sick and something's wrong, they're going to be agitated. They may come in grumpy and mad, and you cannot take that personal. So the only fear that I would have as a nurse would be not making the right judgment that can be life-threatening. So what I do is, in my clinic, which is a protocol, we have something here where we have to stop, and it's a primary care timeout checkout list. So you want to identify a patient, of course, by name, date of birth, and last four. Sometimes you have to verify the full social, because sometimes people have the same name and last four, and sometimes they're not related, so that can be scary for allergies and different things like that. You want to also have an informed consent, identify the procedure and site, and then also you want to take the time out to make sure that everything is correct, and you want to verify with another nursing staff. So this is very important. So overall, as we impact their lives, they also impact ours, and that's a part of a nurse's life. So my experience as a nurse has given me a broad perspective about nursing through the good and bad. My passion has never changed. My goal is to continue education as an RN, and hopefully this will help you decide what you would like to do in your career. Thank you for taking the time out to listen to my career path.